Hello, my name is George Delclos, and I'm a physician and professor at the UTHealth School of Public Health in Houston. And today we're going to go over some aspects of COVID-19. We'll review some of the basic facts, what it is, but also we'll talk about updated information on things called variants, and as well as on the vaccine. Before I begin, though, I do need to provide a disclaimer. I'm not going to read it, but just take a few seconds to read it, and then we'll continue. Okay, so first let's start with an overview, a brief overview, because I think all of us over time have become aware and hopefully very knowledgeable about the COVID-19 pandemic. It's been with us now for over 20 months, so we've all heard about it. But let's go over some basic facts, because sometimes it's good to review basic facts. So first of all, an issue of terminology. When we say COVID-19, we are referring to the disease, the infection caused by a virus. The name of that virus is the Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2 for short. So COVID-19 is the disease, SARS-CoV-2 is the virus. Most recently, you've been hearing a lot of talk about variants of the SARS-CoV-2 virus. So let's talk a little bit about what variants mean. This is not new, but viruses are constantly changing through a process called mutation. They are trying to engage and fight with our bodies to see if they can outsmart our bodies, to try to overcome any resistance we might have, any immunity we might have. And so this is really a natural event that occurs with pretty much any virus, the flu virus, other viruses, and so we do expect new variants of a virus to occur. Now, sometimes these new variants show up and they disappear. Other times, new variants persist. So there are many variants of the SARS-CoV-2 virus, the one that causes the disease COVID-19, and they are being tracked not only in the United States but worldwide. When you go and get what we call a COVID test, which is really a test to see if you have the SARS-CoV-2 virus, the tests that are given, whether they're rapid tests or the more gold standard PCR test, are able to detect all of the SARS-CoV-2 variants, but they won't tell you which variant you're exposed to. You need to do additional tests that are not routinely done, called genome sequencing, to find out which variant is the one that you may be harboring or that is in your community. We give these variants names. We started off by giving them some numbers, but that became so complicated that more recently we've started giving them names from the Greek alphabet. So alpha, beta, delta, which is the one we're hearing about now, or gamma. And the currently dominant variant in the US and worldwide, as you know, is the Delta variant, which if we use its number is B.1.61.7. I didn't even say that right. It's B.1.617.2. So very complicated to use the number. It's a lot easier to just say Delta. Why do we keep track? Well, in this map, and this is the most recent update from the Centers for Disease Control and Prevention in the United States, what we see on the left, different colors, are different variants. And we're seeing what proportion of all cases of COVID-19 are being caused by which variants. Notice that on that graph on the left, we're starting back in mid-June. At mid-June, the dominant variant, the one that was most commonly present in the United States, was not the Delta variant. It was what we call the Alpha variant, also known as B.1.1.7. But look at how quickly over the next several weeks and months the orange has taken over. That's the Delta variant. And we see that nowadays, as of September 11th, way on the right, it is pretty much the entire it responds for the overwhelming majority of cases in the United States, about 99.4%. So almost everything that we are seeing now in the United States in terms of COVID disease is being caused by this Delta variant. That's important because we know that the Delta variant is much more contagious, so it can be spread much more easily than other variants like the Alpha or the Beta variants that we had before. There's also some evidence that the Delta variant might cause more serious disease than the others. That's why it is so important to get it under control. So that's all I want to say about variants for now. Let's go back and revisit how COVID-19, the disease, is spread. The main way it is spread from person to person is through what we call droplets. These are fairly visible, generally, liquids that are released when somebody talks, sneezes, or coughs. So when you sneeze, for example, and you see that spray that comes out, from your nose or mouth, those are droplets. They are large. The fact that they are visible already indicates that they are large. And these infectious droplets can land in the mouths or noses of other people who might be nearby, and they in turn might inhale them into their lungs. So that is the main way by which COVID is transmitted, and that's why masks are so important, because masks, even if it's a cloth mask or a surgical mask, it doesn't have to be like an N95 respirator. Even those surgical masks or cloth masks can be effective at stopping droplets. Again, they're visible, they're big, and so they tend to stay inside the mask if you're wearing it. Now, there are other ways that COVID can be transmitted as well. It may also be spread if you touch contaminated objects and surfaces. So, for example, if you are carrying the virus and you touch your nose or throat and then touch a doorknob, for example, and other high-touch areas, you could be contaminating that doorknob, and then somebody else could come behind you, try to open the door, and then from there take that hand that now has the virus on it and touch their nose or mouths and acquire the disease. We also know that people who don't have symptoms may be still infected, even though they don't have symptoms, even though they're not sick, and they can still spread it to other people. You may have heard something about the SARS-CoV-2 virus, or COVID-19, being spread not only by droplets, but over longer ranges. And it's actually uncommon. Even though COVID is very contagious, it is not as contagious as other diseases like measles or tuberculosis, that once you exhale into the air of a room, for example, those much tinier particles than droplets, we call them aerosols, may stay in the air for a long, long time and then be inhaled by other people. Now, what is possible, though, even though it doesn't seem like long-range aerosol transmission of this virus occurs with the SARS-CoV-2 virus and COVID, it is possible that in certain circumstances there may be aerosols that are generated at short ranges. So, for example, if somebody is singing, or if you have asthma, for example, and you also have COVID, and you take one of those breathing treatments that you've probably seen asthmatics take, that generates aerosols, and if you happen to be an asthmatic with the virus, then that aerosol is going to contain that virus, and other people can be exposed to you, even though it's not a droplet and it's not at a close distance. So this short-range aerosol transmission of COVID is going to be especially concerning in areas like crowded medical wards where people are not masked, or inadequately ventilated spaces. That's why there's been, for example, so much talk about improving the ventilation system in schools. It's also the reason that there have been warnings about avoiding very crowded gatherings like concerts or meetings where you aren't able to keep distances. Like I said, there are certain procedures even in hospitals and other health facilities that can generate fine aerosols, like these nebulized breathing treatments that patients get. And so when that happens, you may have seen that doctors and nurses who are around such procedures actually wear a higher level of protection over their faces and eyes than just a simple surgical mask or a cloth covering. They actually wear respirators, like N95 respirators. They also wear eye coverings, because those aerosols can be generated, and a mask, a simple surgical mask, may not be enough protection. What are the symptoms of COVID? So look at the bottom right of this slide, and this is the first important point I want to make. When you are exposed to somebody with COVID, and if you are not adequately protected, your face isn't covered, your eyes aren't covered, you're not vaccinated, then you can be exposed and you are at risk of getting the disease, the COVID-19 infection. It usually takes somewhere between 2 days to 14 days after you've been exposed to that person who has COVID for you to get sick. 2 to 14 days, usually around, most cases occur between days 5 and 8, but some occur as soon as 2 days and some occur as long as 14 days after that initial exposure. And what are we looking for? Well, there's a wide range of symptoms. And you have the ones that are on the current CDC list of COVID symptoms listed here. So we have fever, chills, coughing, shortness of breath or difficulty breathing, headaches, runny nose, nasal congestion, muscle aches, sore throat. Very important, a new loss of smell or taste. It doesn't happen in everybody, but it is very common, and it's one of the more prominent symptoms of COVID-19, and even diarrhea may be present in some patients. So these are the symptoms of COVID-19. So we've talked about what COVID is, what the SARS-CoV-2 virus is, what variants are, how you can get exposed to COVID, how it can be transmitted to others, and what the symptoms are. Now let's talk a little bit more about numbers. So what is the current situation as of September 16th, which is the day I'm making this recording? I check the numbers every single day and I try to give you the most updated information. So by the time you hear this recording, things may have changed or not. Just bear that in mind. But as of today, September 16th, this is the most current information. If we look nationally in the United States, this goes back to the very beginning. This graph goes back to the very beginning of the pandemic, back in February of 2020. You see the red graph at the top, and look over at the left, you'll see it says February 2020, all the way up to today, to September 2021. And you'll see that over this 20 or so month period, there have been different waves or surges of COVID-19. The first one was around March to about June of 2020. We thought it was a whole lot of cases, but it didn't even come close to what subsequent waves or surges have amounted to. Back in mid-summer of August of 2020, we had a second surge, July, August, that was higher than the first one. And then we had a huge surge beginning around November of 2020 and lasting until February of 2021. By huge, I mean in the United States, there were days where we had very close to 300,000 new cases in one day. In one day. Eventually that third wave decreased. This also coincided with the availability of vaccines, and we do think that getting people vaccinated played an important role in having that third wave end. And numbers were getting better until about July of this year, when the fourth wave in the United States, which is the one that's being caused by the Delta variant that I mentioned before, hit and took off like a rocket. And where we are now is we are still in very high numbers with a lot of variation from day to day. There have been some days in this fourth wave that have reached as high or almost as high as during the third wave. You might see those very thin lines that hit close to 300,000 cases a day. But the dark red line, which is the 7-day average, overall is lower, but still way too many cases. We're still around 150,000 new cases per day in the United States, which is about 10 times too high or too many to feel comfortable. You may notice, if you look at the red graph, that it looked like a few days ago it started to come down, but then there's a tiny spike way over the right of the graph that is probably due to an increase in cases attributable to the Labor Day weekend. But counting cases is not the whole picture, because many of these cases may be mild, may affect people who are able to handle them at home. They don't get short of breath, they don't need to be seen in an emergency room, and even though we don't want them to happen, that's not the only consideration when we're talking about the COVID epidemic and how serious it is. We have to look at subsets of these numbers. So for example, one very important piece of information is how many of these cases are resulting in hospitalizations. And so we'll see that, for example, as of yesterday, September 15th, we had 152,000 new cases in the US, but we also had close to 100,000 people hospitalized. Now, these are people that have been hospitalized, some of them for several days, maybe even weeks. Others were just hospitalized yesterday, but close to 100,000. Again, this is way too many cases hospitalized. And finally, the most serious adverse consequence, which is, of course, dying from this infection, we're still too high. We are close to 2,000 cases a day, between 1,500 and 2,000 cases a day. So typically, when a wave starts to go down, the first thing that you'll see is that the number of total cases will go down, but hospitalizations and deaths won't. That's because there's a lag time. It takes some time between when you get sick, you go to the hospital, and there's a lag time between when you're hospitalized and when you eventually die from COVID during that hospitalization. So we do want to see decreases in cases, and there is some early evidence that maybe we're leveling off, maybe even starting to decrease our number of cases, but the hospitalizations and the deaths are still high. If the number of cases continue to stabilize and hopefully decrease, we should see that reflected in a decrease in hospitalizations and deaths, probably something like 10 to 14 days after they start to drop, if that is a sustained drop. So this is the current situation. So that's enough about COVID, the infection, and SARS-CoV-2, the virus. Let's talk about what the main topic is today that I want to get across, and that is vaccines. So what's the vaccine situation? We're going to talk a little bit, some general facts about vaccines, which I think most of you know, but it never hurts, like I said before, to revisit basic assumptions. Currently in the United States, there are 3 vaccines that have been authorized by the U.S. Food and Drug Administration. You probably heard the term FDA. The FDA is the agency of the federal government that is charged with reviewing the evidence on any new medication, not just COVID vaccines, but any new medication or vaccine, and deciding whether it is effective and safe for human beings to take. The FDA, even though it is an agency of the United States, is the world leader on reviewing evidence and making recommendations in terms of the safety and efficacy of vaccination. And we have 3 vaccinations that are currently authorized in the United States. These are the Pfizer, also known as BioNTech, the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine. And I'm sure all of you have heard these 3 names at some point in time. All of these 3 are able to be given to human beings. They are authorized by the U.S. Food and Drug Administration, but they are under this emergency use authorization, which is an authorization that is short of full approval by the FDA, and these emergency authorizations are issued when there is a critical situation, and I think we would all agree that the pandemic is a critical situation, and when there's enough data to at least initially okay the use of that vaccine, the administration of that vaccine, because the benefits outweigh the risks greatly. So all 3 have been under an EUA, emergency use authorization. Now more recently, in the last several weeks, the FDA gave full approval, which is the highest level of approval, to the Pfizer vaccine. And so that's important. It's not on this slide because this slide is before it gave approval. But Pfizer, some people say, I don't want to get the vaccine until it's fully approved. Well, we have a fully approved vaccine now, Pfizer, and the Moderna vaccine is probably not too far off from securing full approval. The Johnson & Johnson vaccine is lagging behind, but it also became available over 2 months after the first two vaccines, Moderna and Pfizer, were made available. So it's not surprising that they are lagging behind. So everybody is aware that there is a massive public health effort in the United States to get people vaccinated. Why? Because the data are very solid that vaccination is the best way of getting this pandemic under control and getting back to leading a normal life. So how are we doing on that campaign? Some of y'all may remember that the Biden administration had promised that, or had set a goal, it's probably more accurate to say, for all adults, that means 18 and up, to have reached a level of vaccination of 70% by July 4th. So by July 4th, the expectation was at least 70% of all adults would have received at least one dose of the vaccine. Well, July 4th came and went, and we did not achieve that goal of 70%. Unfortunate, but that did not stop the national effort. The vaccination effort continues, and now we're at 76% of all adults who have received at least one dose, and 65% of all adults are fully vaccinated in the United States. You may remember that adults were okayed to be vaccinated before kids were. But starting several months later, actually, the Pfizer vaccine was also given authorization to be administered to kids between the ages of 12 and 17. That started, I'm trying to remember, but it was somewhere around April or May, I believe, of this year. So several months after we started vaccinating adults. Yet that vaccination effort of kids 12 to 17 has been going very well, and they've been rapidly catching up to the point that they are almost at the level of adults and up, 74% with one dose and 63%. When we look at the overall level of vaccination in the U.S. population, this means all ages, including kids who are not allowed to get the vaccine yet. So kids, newborns, 5-year-olds, 6-year-olds, anybody under the age of 12. When we look at that denominator, about 63% of the U.S. population has received at least one dose, and only 54% are fully vaccinated. We need to do better. We are getting there. We are slowly chipping away, but we need to do better in order to reach that level of vaccination of the entire population where we will be able to protect even those few that remain who are unvaccinated. This is known as herd immunity, and you've probably heard that term as well. So we are making progress, but it's not enough. We need to do better. We need to keep vaccinating. Why is vaccination so important? Because vaccination results in decreased risk of acquiring COVID infection, of transmitting COVID infection, of being hospitalized with COVID infection, and of dying from COVID infection. And if you don't believe me, look at these two maps. On the left is, as of today, September 16th, the map of the United States in terms of hotspots of COVID cases. The darker the spots, the closer to purple that they are, the greater the number of cases. So you see, for example, that the southern United States and the lower eastern coast are darker than, for example, the northeast part of the United States, or the southwest part, Arizona, California. There are fewer cases. So the darker the color on the left, the more cases. The lighter, the fewer cases. Now on the right, you have the distribution of vaccinations in the U.S. And remember that I just gave you some numbers. That's the national picture, but there's tremendous variation from state to state. And the darker the colors on the map on the right, the more people that are vaccinated in those areas. So you see high levels, for example, in the northeastern United States, along the California coast, New Mexico, even certain chunks of Arizona, and the border region of Texas, for example. But most of the South and the eastern coast, the southern part of the eastern coast of the United States, is lighter in color. That means fewer people are vaccinated. And they map onto where the cases are occurring. So the point here is that the number of cases of Delta variant COVID-19 infection are occurring predominantly in those parts of the country that have the lowest vaccination rates. And conversely, the parts of the country that have the highest vaccination rates have the lowest number of cases of COVID. That's why we are saying that vaccination is so important. But it's not only number of cases. Remember that I said before, it's not just a matter of counting cases. We have to look at the severity of the cases and see whether vaccination makes a difference or not on if you're going to get COVID, is it going to be a severe case? We do know that people who are fully vaccinated, some of them are getting COVID, but most of them are having very mild cases that they can manage at home. Let's look at some proof of that. So if we start, now the CDC is not tracking this type of information as well as it does national rates. So we have to go and give examples of different states. The states individually are doing a much better job of tracking this. So for example, Washington State Department of Health, we can use their experience to see what is the risk of getting any infection related to COVID or any COVID infection, depending on whether you're fully vaccinated or not. And so they did this estimate. These are data from through the end of August. And they estimated that if you are fully vaccinated, 1 out of every 10,000 fully vaccinated people would have what we call a breakthrough case. They would get infected per day. In contrast, people who are not fully vaccinated, and especially people who are unvaccinated completely, it's about 9 to 10 times higher. 9 out of every 10,000 per day. So that's seen on the graph here. But these are just cases. What about severe cases? So if we look at hospitalization, which is one indicator of a severe case, and these data come from Los Angeles County. They're a little bit older, but it serves to illustrate the point. As of the end of July, and the Delta variant was rampant at the end of July and all of August, and even now, as I said earlier. If you were fully vaccinated, your risk of being hospitalized with a COVID infection was less than 0.1%. In contrast, if you were not fully vaccinated, it was almost 100% of the cases, 99.9% of the cases, and that's seen also in the graph on the right. On the top, that's total number of cases between unvaccinated and fully vaccinated. But look at the graph at the bottom, which is the hospitalization rate over 7 days. And you'll see that the dashed black line represent the unvaccinated, and the fully vaccinated is a solid blue line. You can see the difference, especially toward the end of July. Almost all of the cases hospitalized were among the unvaccinated, whereas the fully vaccinated were barely a blip on the radar screen. And the consequence, which none of us desire, are deaths. What is the risk of death if you acquire COVID and you're fully vaccinated or not? The death rate of fully vaccinated people is 0.1, and these data come from Wisconsin, 0.1 out of every 100,000 people. If you're not fully, and this is 100,000 people in the general population, okay? So that includes people who have COVID and people who don't have COVID. The denominator is that all 100,000 are fully vaccinated, so it's 0.1. If we look at 100,000 people who are not fully vaccinated, there's 1.1 death per day among that group. Now you say, well, 1.1 out of 100,000 is not a lot. Well, first of all, it's many orders of magnitude greater than 0.1, which is what we see in fully vaccinated people. But also, 100,000 people, we live in a country with 340 plus million people. And it's estimated that currently about 80 million people are still not fully vaccinated in the U.S. That would translate into a whole bunch of deaths, and it is translating. We saw the previous slide. We're around 1,500 deaths a day from COVID, and the majority of them, the overwhelming majority, are among unvaccinated persons. This is a summary slide. This one is from Pennsylvania. Remember I said I was giving you state data because CDC doesn't track this as well as the states individually do. And this is just from the Pennsylvania Department of Health, published yesterday. And it gives you the final percentages. So they've kept track of all of the cases of COVID in their state recently and through September 6th or 7th. And the number of cases between January 1 of this year to September 7th, which is around 640,000 cases, 94% of those folks were unvaccinated or not fully vaccinated. What does that tell us? That tells us that being fully vaccinated is protective. It's not perfect because there's 6% of these folks who were fully vaccinated that did get COVID. However, the majority of these fully vaccinated persons did not have severe illness. So if we look at how many of the people, of the 35 or 34,500 people in Pennsylvania during that same period of time who were hospitalized, how many of them were unvaccinated? 95% were either unvaccinated or had only had like one dose. They weren't completely vaccinated yet. Again, overwhelmingly the hospitalizations occur in people who are unvaccinated or not fully vaccinated. And what about deaths? 97% of the deaths in Pennsylvania occurred among people who are unvaccinated or not fully vaccinated. So there is very strong evidence, and even though this is from Pennsylvania, this applies to, we see this pattern over and over again in other states. Overwhelmingly, if you are fully vaccinated, your risk of acquiring COVID-19 is very low. If you do get it, your risk of getting hospitalized with severe illness is even lower. And if you are hospitalized, your risk of dying from it is even lower. So all of these make for strong arguments in favor of getting vaccinated. So I'm going to finish up now with some questions that I've been asked and that maybe you have. And there will also be an opportunity for you all to ask additional questions, and I'll be happy to answer them. If they email them to me, I'm more than committed to answer any questions that people have. But these are questions that I often get. So let's take them one by one. First, after getting a COVID-19 vaccine, will I test positive for COVID-19 on a viral test? No, it's impossible. The reason for that is none of these COVID vaccines contain the SARS-CoV-2 virus that causes the infection. You only test positive. Remember, I said we call it a COVID test, but it's really a test for the presence of the virus, of the SARS-CoV-2 virus. It is impossible to test positive if you've been vaccinated because of the vaccine. Now, you might test positive because you have a breakthrough infection, sure, but it's not because it's the vaccine that's giving you what we call a false positive test. Can pregnant or breastfeeding mothers receive the vaccine? Absolutely yes. Not only can they should. Why? Because pregnant women are at a higher risk of having severe illness, COVID, while they're pregnant. They are more likely to wind up in the hospital. They're more likely to have preterm births. They're more likely to get sick and die. So the recommendation, it was in the United States as well as worldwide now, is that pregnant women please get vaccinated in order to decrease your risk. And if you are breastfeeding your child, you should also get vaccinated if you're not already. Why? Because there's certainly very good evidence that it will not harm the baby, but not only will it not harm the baby, it may even give that baby protection. Remember, we can't vaccinate babies just yet, but one way of getting antibodies, some level of protection, seems to be possible through breast milk. Should I consult my doctor before getting the vaccine? Well, you should always consult your doctor if you have doubts. If you're otherwise convinced about getting the vaccine, just go ahead and get vaccinated. You don't need to consult your doctor for everything, but if you have serious doubts or questions, of course, it's prudent to talk to your doctor and get some advice that you can trust. Will the vaccine cause infertility? No, absolutely not. This has been looked at over and over again, both in women and in men. It cannot cause infertility. It's impossible. Will the vaccine cause COVID-19 or a positive COVID-19 test? Well, I just answered that. Sorry, I repeated it again. The vaccine will not give you a positive COVID test, and it certainly will not cause COVID-19 the infection. Why? Because it doesn't contain the virus. If you don't have the virus, you can't have the disease. Why should we still wear masks after vaccination? When can I stop wearing a mask? This is correct. You may remember that back in May of this year, that people who were fully vaccinated, the CDC came out and said it's okay to take off your mask, whether you're in indoor settings or outdoor settings. But then in July they said, oops, we jumped the gun a little bit. And this was because the Delta variant was already showing up at some people who had been fully vaccinated, but also we saw that even though you may be fully vaccinated and you don't get the infection, the COVID infection, you might still have been exposed to somebody who had the virus and you are carrying the virus in your nose or mouth, even though you're not sick, but that makes it possible for you to spread it to somebody else. So then CDC came back in July and said, oops, we jumped the gun. Even people who are vaccinated should wear masks in indoor settings, at least until this Delta surge is over. So when can I stop wearing a mask? When this current Delta variant wave that we are experiencing comes under control and gets back to tolerable levels, then we'll be able to take off our masks. Now, this doesn't mean that people who are fully vaccinated need to wear masks in all settings. So outdoors, for example, the risk of transmission is very low, and you can, in most cases, unless you're going to a rock concert, or something like that where there's tons of people, but in general, outdoors, in a normal setting, fully vaccinated people shouldn't have to wear a mask. But indoors, we are recommending it again, at least until this current wave blows over. What am I allowed to do after I'm fully vaccinated? Well, pretty much anything. But we are recommending currently, as I said, wearing masks in indoor settings until this wave subsides. I've already had COVID-19 and recovered. Should I still get vaccinated? I get this one a lot, and the answer is yes. And then people say, well, why should I get the vaccine if I've had it? Isn't it true that I'm immune after I get it to getting another infection? Well, it is true that having the actual disease, COVID-19, does give you some immunity from a second infection. But we don't know how long that lasts. We do know it lasts for a while, but we don't know how long it lasts. We do know that cases of reinfection, meaning having a second episode of COVID, are certainly possible. And we also know that the level of immunity that vaccine gives is higher than the level of immunity that you get from having the disease. Now, if you have had the COVID-19 infection and on top of that you get vaccinated, there's very strong evidence that your level of protection is exceedingly high. It's very high, very good, maybe even better than people who are fully vaccinated but have never had COVID infection. So the sum of COVID-19 infection and getting fully vaccinated seems to confer very strong protection that may actually be very long-lasting. How long will the COVID-19 vaccine protection last? And will we need it every year like the flu shot? At this point in time, we don't know. We think that a third dose, what we call a booster dose, may be indicated at some point. Today, as of September 16th, 2021, the FDA has not made its recommendation. It's actually meeting tomorrow to review all of the evidence, and then it will make some recommendation as to who should get a booster, whether everybody who's been fully vaccinated already should get a booster, or whether we should start just with certain sectors of the population. You may remember that when we first started giving vaccines back in December of 2020, it wasn't, open season, everybody can get vaccinated. First, we vaccinated people in nursing homes, the elderly, healthcare workers, and then we slowly expanded to other groups of people until we were vaccinating all adults. We went very quickly to that point, but it was a staggered approach by targeting the highest risk groups first. And then we extended it to kids 12 and up. It may be that with boosters we follow a similar approach. I don't want to guess what the FDA is going to recommend, but by the time you hear this recording, you will probably already know because it will have been on the news. So tomorrow, September 17th, the FDA is meeting. They will make their recommendations to the CDC, to the Centers for Disease Control and Prevention, and in turn the CDC will make the recommendation as to how we're going to handle booster shots. We were supposed to start administering booster shots on Monday, September 20th, but we will see if that date holds firm or if it'll be a few days later. Right now I can't tell you as of the date of this recording. Why should I get a COVID-19 vaccine when I can just wear a mask and physically distance? Well, it's true that you can just wear a mask and physically distance, but people are getting a little tired of masks and physically distancing and not leading normal lives. So the quickest way to get back to normal is by getting vaccinated. But in addition, although the mask and physical distancing are very effective at decreasing our chances of getting sick with COVID or of spreading it, they are still not as strong as getting vaccinated. Vaccination confers a much higher level of protection than just wearing the mask and physically distancing. And doing all three confers even greater protection. Why is it important to self-monitor for symptoms? Because nothing is perfect. Even if you are obviously if you are not vaccinated, you should always monitor for COVID symptoms and get tested as soon as you have one of the symptoms from that list that I showed early on in this presentation. If you're fully vaccinated, however, it's still important to self-monitor for symptoms because even though it is very rare for you to get COVID-19 after you're fully vaccinated, it is not impossible. And so we should be, attuned, we should be attentive to whether we have symptoms, especially if we've been in a situation where we might have been exposed to others, to monitor for symptoms. Tests are now widely available. They are very quick. If you have symptoms, you're worried that you might have had COVID, go ahead and get tested, and you won't have any doubts one way or another. And that was it. That's what I wanted to offer to you all today. Thank you for being patient with me and listening. I hope this was useful.